Let's do a little case study, shall we? This is a lymphatic iris from a male client who is 79 years of age. He came to me originally wanting help with weight loss. Now you gotta know, I don't do weight loss. I do not put together weight loss programs. I put together wellness programs. So as he and I were talking and I had his eye photos, it came out that he also had some joint issues. He had become very sedentary because his joints hurt so much. It also came out that he had had prostate cancer and had had hormone therapy for that, and that he also had a diagnosis of congestive heart failure. And with that congestive heart failure, he was on approximately 7 different medications for everything from blood thinning to cholesterol to heart arrhythmia, you name it, he was on it. So he had a lot of different medications. As I was looking at his eyes, I noticed several things. First off, he's lymphatic, which means he's predisposed to having elevated acid through his body, not digestive, but body acid. I noticed that his nutritive zone looks like it is inherently a little on the deficient side. So that means he likely doesn't break down his foods very well. And at the age of 79, that will have declined significantly as well. He has the lipemic diathesis, which says the liver doesn't want to handle his carbs properly and is likely sending him towards some kind of either cholesterol issue or triglyceride issue. We see that he's hydrogenoid, which means his lymphatic system doesn't want to do its job. And of course, if he's not moving his body, it's even harder for the lymphatic system to do its job of getting rid of toxins, of purifying things. And if he can't get rid of toxins, they'll accumulate, and that will force his body to gain even more weight. As we're looking at his eyes, he's got a blue haze hanging off the edge of his iris. This is a strong indicator that he does not have a strong circulatory system. We have the gray patch in his sclera, which again is very dynamic. This is what's happening now. And for him, that again means challenges with the circulatory system. You'll notice we use different angles and different lighting to see different things. He's got wrinkles in his eyeball, which tells us he runs in the sympathetic mode, which means he's burning through B vitamins, vitamin C, calcium, and magnesium very quickly. He has other pigments in his eyes that give us information about how various organs want to be impacting other organs in his body. We could dissect every little radial furrow. I assure you that would be a futile effort. He's got so many radial furrows in various places that we would be here for a month of Sundays, and we would be no further ahead for that. Again, looking at the sclera, we've got the gray patch, we've got the beginning of a pterygium. We've got more lipemic diathesis in the inferior margin of the iris, so we know that the liver enzymes are likely out of balance or have been for a while. We also see that it looks like he is fermenting his carbohydrates, which I find often goes hand in hand with a couple of things, type 2 diabetes being one of them. Now, I'm not licensed to diagnose a disease process, but I sure can encourage my clients to go back to their doctor and request certain tests. I find that when I've got an older client like this, doctors are happy to run tests. And so I did request that this gentleman, aside from getting all of his blood work updated for cholesterol and CBC and triglycerides, I also wanted a hemoglobin A1C from him. So this is his right eye. You'll see it tells us very much the same story. We've got the lipemic diathesis, the lymphatic constitution. We've got the dull and marked nutritive zone. We've got the same kind of pigments telling us the liver wants to have an impact on various organs. We've got the same hydrogenoid tendencies as well. So he's got some basic markings, and I don't need to dissect every little thing in here. Doing that is going to be futile. It's going to give us a lot of questions about a lot of things that are not relevant right now. When you know your anatomy and physiology and you've got someone who's got weight gain and you see an eye like this, you understand instantly the impact the liver is having on that, the impact the lymphatic system is having on that, the impact the poor digestion is having on that. Right? And so you can create a wellness program that addresses many things, but it can be a very simple program. And so as we continue to look at his eyes, we see more of the same, the gray shading in the sclera, the inferior lipemic diathesis, more gray shading in the medial sclera. Right, so he's got all of these markings that tell us a story. So next question for him as I looked at his eyes was, what do you eat? Breakfast was typically steel-cut oats with apples and raisins. Apples are pretty good for you. Rice cakes for snack in the morning. And lunch would often be rice cakes with cheese and tomato, or apple or a mashed banana on that rice cake. Yogurt and granola, sometimes toast and eggs. He'd have another piece of fruit for a mid-afternoon snack. And he would have chicken, fish, a salad, a veg for supper, and then a big fruit slushie for an evening dessert. Now, this was all on the recommendation of the obesity clinic. This is not the way to eat if you want to lose weight. Not at all. And especially when you've got the problems he's got, one of his other problems was constipation. Although he found that one of his medications was giving him diarrhea and heartburn. So we were having to fight against the symptoms that the medications were creating. So what did we do? Well, first off, I asked him, do you tend to burp a lot? The answer was yes. Do you pass a lot of gas? Yes. And how smelly is that gas? And he said it is eye-watering, room clearing, really, really bad. So what did we do? First thing we did was we changed up his breakfast. I wanted him to have protein within the first 30 minutes of getting up. And so we got him to do eggs and a stir fry of vegetables. Now, he's a funny old fellow, love him to pieces. And he was saying things like, vegetables at breakfast time? No way. And I said, well, just give it a try for a week or two. Let me know how it goes. So he sent me an email after 2 weeks and he said, if anyone had ever told me I would be loving vegetables for breakfast, I'd have said they were crazy, but dang, these vegetables are good. So I really appreciated that he had made the effort, because the only supplements we used with him were a hydrochloric acid supplement to help him digest his protein, and a berberine supplement, because we know that berberine can have some really positive impact on regulating blood sugars. And again, his waist measurement told me he was very likely flirting with type 2 diabetes. So we sent him to his doctor, asked for a whole bunch of tests. His hemoglobin A1C came back elevated. His triglycerides were very elevated. His C-reactive protein was the high end of normal. So we've got a lot of things that are not quite right in his blood, but we've also got him changing up his breakfast, getting some support with his digesting protein and with regulating blood sugars, and negotiated with him that even though his joints hurt, his knees especially, that he would walk 5 minutes once a day. Just start moving, right? And after a week, bump it up to 2 5-minute spots. And then a week later, 3 5-minute spots. Well, actually, by the time he came back at the end of the first month, he was walking 30 minutes straight through and loving it. The payoff for all this was fantastic, because those little dietary changes and the walking, his joints were already hurting less, and he had lost 10 pounds in that first month. He was astonished that it could be this simple. So we've continued to work together for many, many months, and we've continued to reshape his diet, reducing the fruit intake, increasing the protein and the vegetables. And we've continued to see him lose weight. He's now lost 20 pounds. He's lost a couple of notches on his belt. He's very excited about that. His joints don't hurt. His favorite pastime is going on cruises. And was feeling so good that he had booked another cruise. Of course, we had to teach him how to not gain weight on a cruise, but that's okay. So what I want you to take away from this iris assessment is this. When we do an iris assessment, we don't need to nitpick every little detail we see. We need to look at the eyes in the context of what the client has asked for help with. We need to find the markings in the eyes that give us information about why the client has that symptom. And that will guide us to ask appropriate and directed questions that will help us to get to the bottom of this and come up with a program that is simple, that is very succinct, very directed at his problem, but that will also be foundational in creating a lifestyle that he can maintain. And that's what it's all about.